Hi, my name is Tim Quigley. I'm the Chief Nursing Officer and Vice President of Nursing here at South Shore Hospital. I've been here for 7 years. It's a wonderful place. I'm really looking forward to the expansion of the Emerson building. We've built clinical programs based on the needs of the South Shore that are attracting more and more people who need them. So cancer, cardiovascular care, orthopedics are 3 classic programs that really drive the adult medical surgical needs for adding more beds. About 80% of health care is in our facility is unplanned. People enter through the emergency room. The need for inpatient beds generated from patients entering the emergency room keeps on increasing. So as we add more beds on the inpatient side, the backup of those patients waiting in the emergency department will decrease. So you'll be able to get patients to beds quicker. And then a couple other key things. One is that the rooms are beautiful. They're large. All single patient rooms are being added. And they're large enough for the whole family to be there. And that allows the whole family to participate and help us in the care of their loved ones, which is great because right now a lot of our rooms are double rooms. And we have about 17 single rooms. This will really add another 60 single rooms to our capacity. So that's just a huge step forward for us. For the first time, we'll allow our floors to have a clinical identity and build teams of specialized clinicians around the care of specialized patients. Emerson 5 will be our orthopedic floor, and we have about 1,200 trauma patients a year that come to the facility with broken hips and arms and backs, and that provides specialized care on the orthopedic trauma. And then in addition, we do hundreds. I think this year we'll do over 600 joint replacements for hips and knees. So that allows those patients to be with specialized teams of nurses, therapists, pharmacists, physicians that basically specialize in orthopedics. So their care is more evidence-based, with a consistent group of people, and they have much better outcomes. The 25-bed private room Emerson 5 will be one part of a comprehensive orthopedic program. In October of 2011, a $30 million facility is opening in collaboration with South Shore Orthopedics, and that will be primarily based in Hingham, doing arthroscopic outpatient surgery. The patients that go to Hingham will be going home that day. Patients that need orthopedic care, that need overnight stays and inpatient stays would be here on Emerson 5. Emerson 6 will be oncology. Like Emerson 5, 25 single private rooms, large, spacious, great support space for families to room in and stay in and be with their loved one during their care. They will also have a specialized team of chaplains, pharmacists, nurses, social workers, oncologists that specialize in the care of patients with different cancer diseases. So the ability to put together people who are specialized in an area really allows fantastic clinical outcomes to happen. Most cancer patients, most of their care will be on an outpatient basis. They'll stay at their home, they'll go in for radiation or chemotherapy at the cancer center in an ambulatory basis. If they need inpatient care, if they have an infection or they need hydration or things that can't be done on an outpatient basis, that's where the collaboration on the inpatient side with Emerson 6 would happen. To give you a sense, this is a single room. This is one of the larger rooms. From a care process standpoint, if the family wanted to stay over, or multiple members of the family, would be very tight fit. It's hard to move IV pumps around and other pieces of equipment that the patient might need. So it's just hard to work in a tighter space. So to give you a sense on the new Emerson 6, which would be oncology, the private rooms are about twice the size of this. And each of those rooms, all 25 on that floor, would be private. So the ability to kind of provide privacy and comfort for patients is enormously better. The confidentiality, the discussions that would happen with patients are easier. So the new space is just going to be spectacular for us to really support patient family-centered care. So, in summary, I've spent some time talking about what I think is going to be a wonderful inpatient experience for patients and their families. The space on Emerson 5 and 6, the 60 new private rooms both there, as well as 5 new private rooms on Emerson 3 and Emerson 4, really designed by patients and families. We sat down with them and got their ideas about what worked, what didn't. So wonderfully well thought out, clinically supportive for the care that we're, top-notch care that we're looking to deliver, and very grateful for really the opportunity to do this, for patients in the South Shore. So, in summary, just a huge step forward for South Shore Hospital and for the patients it serves on the South Shore. And from a nursing care and team-based care concept, just will be state-of-the-art space to go with wonderful clinicians and to really advance the patient experience. So very grateful for it, and thank you.